Do you wake up feeling stiff? Or maybe you toss and turn all night, unable to get comfortable no matter what you try? What if I told you that your sleeping position, the very posture you hold for 6 to 8 hours every night, is quietly working against your heart, your joints, and even your brain health? Welcome back to Elderly and Wise, where we help seniors take control of their health and happiness, one smart habit at a time. Today's topic is one that almost no one talks about: your sleeping position. And it might just be the most underrated health issue in old age. Most people don't give a second thought to how they sleep. After all, you're unconscious. How much damage can it really do? The answer, as it turns out, is a lot more than you think. Recent research shows that for people over 60, especially those with heart conditions, arthritis, or reduced flexibility, sleeping in the wrong position every night can silently strain your heart, pinch nerves, cause joint pain, restrict breathing, and even increase your risk of poor circulation and falls. Yes, falls, because the stiffness that builds overnight can make you more unstable during your first steps in the morning. But don't worry, this video isn't about fear. It's about solutions. We'll break down the most dangerous sleeping positions for older adults, why right-side sleeping might be silently stressing your heart, how the fetal position many seniors love could actually worsen joint problems, the benefits of back and left side sleeping, how to use pillows to relieve pressure and align your spine, and a simple bedtime stretch routine to keep your muscles happy all night long. So if you or someone you love is over 60, stay tuned, because a better night's sleep might just start with one small adjustment, and it could change your mornings forever. Section 1. Why your sleeping position matters after 60. Let's start with a simple truth. As we age, our bodies become less forgiving. The sleeping positions that worked in our 30s or 40s may now be the very reason we wake up with aching backs, stiff knees, or numb fingers. Why does this happen? Aging and overnight pressure. Every time you lie down, gravity presses your body into the mattress. If you're in a twisted or curled position, that pressure gets distributed unevenly across your joints and muscles. Young bodies can handle this stress and bounce back quickly, but in seniors, tissues are more fragile. Cartilage wears thin, circulation slows, and recovery takes longer. Now imagine you stay in that same contorted posture for 7 or 8 hours every night after night, week after week. That's hundreds of hours a month of pressure building in the same joints: your shoulders, hips, neck, and spine. This can lead to reduced joint mobility, increased morning stiffness, pinched nerves, leading to tingling or numbness, restricted blood flow, and worst of all, hidden stress on your cardiovascular system. That's right, your sleeping posture can affect your heart. The heart-spine breathing connection. When your body isn't aligned during sleep, it doesn't just affect your bones, it also impacts how deeply you breathe, how well your heart can circulate blood, and whether your nervous system is at ease or in distress. If your chest is compressed, your lungs can't fully expand. If your neck is twisted, blood flow to the brain may be reduced. If your spine is bent, your diaphragm can't move freely. Over time, this limits oxygen flow, causes restless sleep, and even puts stress on the autonomic nervous system, which controls your heartbeat and breathing rhythm. And let's not forget about the gut. Seniors often struggle with acid reflux, indigestion, and constipation. And believe it or not, your sleep position can either help or hurt your digestive flow. Why this is critical. After age 60, when you're over 60, your body is in a more delicate balance. Circulation is slower, which means pressure on vessels matters more. Joints are less lubricated, so stiffness builds faster. Muscle tone declines, making you more vulnerable to alignment issues, and recovery from strain takes longer. That's why correcting your sleep posture is not just a comfort issue. It's a health priority. The good news? It doesn't require expensive gadgets or surgery. It starts with awareness and a few smart changes to how you position your body each night. Section 2. The hidden dangers of right-side sleeping. If you ask most seniors which side they sleep on, many will casually say, "Oh, I usually sleep on my right." It feels natural, familiar, comfortable. But what if that very comfort is hiding a slow-growing risk, especially for your heart? This section will challenge a common assumption, that it doesn't matter which side you sleep on, because when you're over 60, it absolutely does. What happens when you sleep on your right side? When you lie on your right side, your body weight compresses everything beneath it, your shoulder, hip, and ribs. But most importantly, your internal organs shift as well, and that includes your heart. The heart is slightly tilted in your chest, with its apex pointing leftward. When you sleep on your right side, the heart is lifted higher in the chest cavity, and some researchers believe this forces it to work harder to maintain proper blood flow. For older adults with heart issues, like atrial fibrillation, hypertension, or arrhythmia, this added mechanical strain may subtly worsen symptoms. A 2018 study published in the Journal of Clinical Sleep Medicine suggested that left-side sleeping may reduce nighttime episodes of shortness of breath in patients with heart failure, while right-side sleeping tended to increase discomfort. Of course, this isn't a blanket warning for everyone, but if you have a sensitive cardiovascular system, your sleeping posture could be making things worse without you even realizing it. Blood flow, gravity, and pressure. Sleeping on your right side can also influence venous return, the process by which blood travels back to the heart from the rest of your body. In certain positions, this flow is slightly restricted, meaning your heart has to pump harder to compensate. In young, healthy individuals, the body adjusts quickly. But in seniors, where blood vessels are stiffer and circulation is slower, this small inefficiency can create problems over time, especially overnight when your heart is meant to rest. And it doesn't stop with the heart. Right-side sleeping can also exacerbate acid reflux, since the esophagus is positioned higher on that side, increase shoulder compression leading to numbness or tingling in the arm, cause neck and jaw misalignment, particularly for side sleepers who don't use a proper pillow. But isn't side sleeping safer than sleeping on your back? Yes and no. For people who snore or have sleep apnea, side sleeping can help keep the airway open. But not all side sleeping is equal. While left side sleeping has been shown to support better breathing, digestion, and circulation, right side sleeping can carry more risks, especially when paired with poor pillow positioning or a too firm mattress. A real-life example. Consider Margaret, a 72-year-old woman with mild hypertension and arthritis in her right shoulder. She's been sleeping on her right side for decades, thinking it helps her feel secure. But lately, she's been waking up with shoulder pain, increased palpitations at night, and occasional shortness of breath when lying down. After speaking with her physical therapist and making one change, switching to her left side with a supportive pillow between her knees, she noticed an improvement in her sleep quality within just 2 weeks. Her shoulder pain decreased, and she felt more refreshed in the morning. This is not an isolated case. Many older adults report similar improvements when they become intentional about their sleeping posture. The bottom line, if you're over 60 and habitually sleep on your right side, it's time to reconsider. The risks, while not dramatic in the short term, accumulate over the years. From heart strain to joint compression to digestive issues, right-side sleeping may be silently sabotaging your health. You don't need to flip your habits overnight. Start by experimenting with short naps or the first half of your sleep on your left side or back. Use pillows to support the transition. And most importantly, listen to your body. If you feel better when you wake up in a different position, that's your body's way of saying, thank you. Section 3. The fetal position trap. There's a reason the fetal position feels so natural. It's the way we first entered the world. Curled up, knees drawn in, arms wrapped close to our chest. As adults, especially seniors, this posture may feel like a warm cocoon, offering a sense of safety, emotional comfort, and body heat retention. But when held for long periods during sleep, especially every night, this comforting pose can turn into a trap for your joints, spine, lungs, and circulation. What is the fetal position really? The classic fetal position involves sleeping on one side, knees tucked toward the chest, chin tilted downward, arms folded or curled near the body. This posture rounds the spine, compresses the chest, and closes off the body into a tight, defensive shape. Now imagine holding that posture for 7-8 hours. While it might help you fall asleep quickly, the long-term consequences can be surprisingly harmful, especially for seniors. How the fetal position hurts seniors. Spinal compression. When you curl tightly, your spine flexes forward unnaturally. Over time, this sustained flexion puts strain on the lumbar discs, contributing to lower back pain, spinal misalignment, and even spinal nerve compression in older adults with degenerative disc disease or arthritis. Reduced lung capacity. A hunched, sleeping position compresses your chest and lungs, limiting how much air you take in while you sleep. For seniors with reduced lung elasticity, or those dealing with sleep apnea or COPD, this can mean shallower breathing, more nighttime awakenings, and less oxygen for the brain. Neck and shoulder misalignment. If your head tilts down and your arms curl inward, your neck, shoulders, and upper back may fall out of natural alignment. This contributes to neck stiffness, headaches, and frozen shoulder over time. Joint stiffness and morning pain. Many seniors who sleep in the fetal position wake up with locked hips, sore knees, or stiff wrists. The bent joints stay inactive and compressed for hours, making them resistant to movement in the morning, a dangerous problem when paired with age-related joint degeneration. Circulatory issues. In a tightly curled posture, blood flow to the extremities can become restricted. This is especially risky for seniors with poor circulation, varicose veins, or peripheral artery disease. Tingling, numbness, and pins and needle sensations are often signs your body is warning you, I can't move blood properly in this position. Why seniors gravitate toward this position? Many older adults sleep in the fetal position because it eases emotional anxiety. It creates a sense of safety and warmth. It helps reduce back pain temporarily by stretching the spine slightly. It mimics a position of rest familiar from childhood. But comfort in the short term doesn't mean safety in the long run. A better way. The open fetal or modified side position. If you love the fetal position and can't imagine sleeping another way, don't worry. You don't have to give it up completely. Instead, adjust it into a healthier version. Keep your legs only slightly bent, not tightly tucked. Place a firm pillow between your knees to reduce hip pressure. Use a supportive neck pillow to maintain cervical alignment. Keep your arms gently in front of you, not under your head or chest. This open fetal position allows your spine to remain relatively straight, your lungs to expand more fully, and your joints to remain in a healthier alignment throughout the night. Real talk, the morning wake-up test. Here's a quick test. If you consistently wake up feeling more stiff than when you went to bed, especially in your back, neck, hips, or shoulders, your sleeping posture is a likely culprit. The fetal position may be slowly aging your spine, even as it comforts you emotionally. Remember, aging gracefully doesn't mean giving up comfort. It means finding smart comfort, where warmth and safety meet alignment and health. But what about snoring and sleep apnea? It's true, back sleeping can worsen snoring or sleep apnea in some people. When lying on your back, the tongue and soft tissues may fall backward into the throat, partially blocking the airway. However, this can often be managed with head elevation using a wedge pillow, anti-snore pillows that support neck alignment, CPAP therapy for those with diagnosed apnea. If you snore mildly or only when you're very tired, sleeping with your upper body slightly elevated can make a big difference. Just avoid stacking pillows which bend the neck. Instead, use a contoured foam wedge or an adjustable bed. Best practices for safe back sleeping. To get the most from this position, use a medium firm mattress that supports your natural curves. Place a pillow under your knees to reduce strain on the lower back. Keep arms gently by your side or on your belly, not overhead. Choose a contoured neck pillow to support your cervical spine. This setup promotes deep relaxation, reduces muscular strain, and minimizes nighttime pain. For whom back sleeping might not work. While back sleeping is great for most seniors, it may not be ideal if you have untreated severe sleep apnea. You suffer from chronic nasal congestion. You experience acid reflux, though this can be managed with elevation. In these cases, modified left side sleeping might be the better option. More on that in the next section. But what about snoring and sleep apnea? It's true, back sleeping can worsen snoring or sleep apnea in some people. When lying on your back, the tongue and soft tissues may fall backward into the throat, partially blocking the airway. However, this can often be managed with head elevation using a wedge pillow, Anti-snore pillows that support neck alignment. CPAP therapy for those with diagnosed apnea. If you snore mildly or only when you're very tired, sleeping with your upper body slightly elevated can make a big difference. Just avoid stacking pillows which bend the neck. Instead, use a contoured foam wedge or an adjustable bed. Best practices for safe back sleeping. To get the most from this position, use a medium firm mattress that supports your natural curves. Place a pillow under your knees to reduce strain on the lower back. Keep arms gently by your side or on your belly, not overhead. Choose a contoured neck pillow to support your cervical spine. This setup promotes deep relaxation, reduces muscular strain, and minimizes nighttime pain. For whom back sleeping might not work. While back sleeping is great for most seniors, it may not be ideal if you have untreated severe sleep apnea. You suffer from chronic nasal congestion. You experience acid reflux, though this can be managed with elevation. In these cases, modified left side sleeping might be the better option. More on that in the next section. Section 5. Left side sleeping, a gentle hero for digestion and circulation. If there's one sleeping position that seems to strike a balance between comfort and health benefits for older adults, it's left side sleeping. Unlike the right side, which can add stress to the heart and worsen reflux, the left side is often described as the healthier side, especially for people over 60. This may sound like a small detail, but sleeping on your left side can produce a cascading effect of improvements for digestion, circulation, and even lymphatic drainage. Let's dig into why this position has earned its place as a favorite among health professionals. Anatomy and gravity, why the left side wins. The human body isn't symmetrical. The heart, stomach, pancreas, and large intestine are all tilted slightly in the body, and their positioning plays a big role in how gravity affects our sleep. When you sleep on your left side, the stomach and pancreas sit naturally below the esophagus. The heart rests in a less compressed position. The lymphatic system drains toward the left thoracic duct. Gravity helps food move through the intestines more efficiently. This alignment allows your internal systems to work more efficiently during sleep, which is a critical time for repair and recovery. Benefits of left side sleeping for seniors: eases acid reflux and heartburn. One of the most well-documented benefits of left side sleeping is its ability to reduce acid reflux. When you lie on your left, stomach acids remain lower than the esophagus, reducing the chance of nighttime reflux or GERD episodes. For seniors who struggle with indigestion, hiatal hernia, or nighttime coughing, this can be a game changer. A 2022 study in gastroenterology and hepatology showed that patients experienced up to a 50% reduction in reflux episodes when switching from the right to the left side. Supports heart function. While back sleeping also supports heart health, sleeping on the left side takes pressure off the inferior vena cava, a large vein that carries blood to the heart. This makes it easier for the heart to pump, especially in seniors with hypertension or mild heart failure. It may also reduce palpitations at night and improve overall circulatory efficiency. Promotes lymphatic drainage. The lymphatic system removes waste and toxins from the body. The largest lymphatic duct, the thoracic duct, is on the left side. Sleeping on your left may help your body detoxify more efficiently by promoting natural lymph flow. For seniors focused on supporting immune function and reducing inflammation, this benefit can't be overlooked. Encourages better bowel movement. The small intestine moves waste into the large intestine on the left side of your body. Sleeping on your left encourages natural intestinal peristalsis, the wave-like muscle movement that pushes food waste toward elimination. Many older adults who struggle with constipation find relief simply by shifting to left side sleeping, particularly when paired with proper hydration and fiber intake. Reduces pressure on the spine. When paired with a supportive pillow between the knees and a soft pillow under the neck, left side sleeping can reduce strain on the lower back. This is crucial for seniors with sciatica, spinal stenosis, or herniated discs. Left side sleeping done right. To maximize benefits, keep your knees slightly bent, not curled up tightly. Use a pillow between your knees to align the hips and prevent twisting. Make sure your head and neck are level with your spine. Rest your lower arm comfortably in front of you or under a body pillow. This alignment prevents joint strain while supporting digestion and circulation throughout the night. A word of caution. Left side sleeping isn't perfect for everyone. If you have certain heart conditions, chronic shoulder pain on the left, or discomfort in this position, consult a healthcare provider before making it your go-to posture. But for most seniors, it's a safe, gentle, and therapeutically powerful sleep position, especially when combined with the right pillows and mattress support. Section 6. Pillow strategy. Small changes, big relief. Think pillows are just for your head? Think again. When it comes to healthy sleep for seniors, pillows are more than comfort items. They're alignment tools. Used strategically, the right pillow can relieve back pain, reduce neck strain, improve circulation, and even prevent dangerous falls by reducing stiffness upon waking. It's not just about what you sleep on, it's also about what supports you while you sleep. The role of pillows in senior sleep health. As we age, our muscles weaken, joint flexibility declines, and natural spinal curves become harder to maintain. A pillow that doesn't support these changing needs can leave you waking up in worse shape than you went to bed. But here's the good news. Simple pillow adjustments can have dramatic results. 1. Pillow for the neck, cervical support. Your neck is not just a hinge, it's the highway for blood, oxygen, and nerve signals between your brain and body. When the neck is bent too far forward, backward, or to the side during sleep, it can result in tension headaches, numbness in arms or fingers, neck stiffness, dizziness upon waking. For seniors, a contoured cervical pillow can support the natural curve of the neck, keeping your head aligned with your spine. If you're a back sleeper, use a low-profile pillow that cradles your neck without pushing your head forward. For side sleepers, the pillow should fill the space between your ear and shoulder to avoid tilting. 2. Pillow under the knees, back sleepers. When lying on your back, the natural curve of your spine causes the lower back to slightly arch. Placing a pillow under your knees flattens this curve gently, reducing pressure on your lumbar spine. It also helps prevent your legs from turning outward, which can torque the hips over time. This small trick can reduce lower back pain, improve spinal decompression, ease tension in the hip flexors and hamstrings. Pillow between the knees, side sleepers. Side sleepers, especially those who favor the left side, should always use a pillow between their knees. Without it, your top leg can slide forward and twist the spine, leading to lower back discomfort, hip and pelvic misalignment, morning joint pain. A firm, medium-sized pillow works best to keep the knees aligned and the hips level. Bonus, it also reduces knee-on-knee pressure, which can irritate arthritic joints. 4. Body pillows and bolsters for full body support. Body pillows can support multiple joints at once. If you're prone to shifting during sleep, a full-length pillow along your chest and knees can stabilize your position. Seniors with shoulder pain, knee problems, or fibromyalgia often find body pillows comforting and supportive. Bolster pillows placed behind the back can also prevent rolling into harmful positions during the night. 5. Don't forget the mattress and pillow relationship. Even the best pillow can't help if your mattress is sagging. Think of your mattress as the base and your pillows as the sculptors that shape how your body rests. Together, they should create a system that supports your entire musculoskeletal structure. Quick tip: replace old pillows. If your pillow has lost its shape, smells odd, or causes neck pain, even if it's expensive, it's time to say goodbye. Most pillows should be replaced every 1 to 2 years, especially for seniors whose needs evolve more quickly. Bonus section. Pre-sleep stretching routine for pain-free mornings. It's no secret that many seniors wake up feeling stiff, sore, or even off balance. But what if that morning struggle wasn't just about how you sleep, but how you prepare to sleep? This is where a simple pre-sleep stretching routine can make a life-changing difference. Stretching before bed isn't about becoming a gymnast. It's about sending a signal to your body. It's time to release the tension of the day. Gentle movement can calm the nervous system, ease tight muscles, improve circulation, and prime your joints for restful, pain-free sleep. Let's walk through a quick, senior-safe routine you can do right in your bedroom. No equipment needed. Step 1. Neck rolls. Release the day's stress. How to do it. Sit or stand tall. Slowly roll your head to the right, then to the left in a semicircle. Repeat 3 to 5 times in each direction. Benefits: loosens up tight neck muscles and improves circulation to the brain. Great if you've been sitting or looking down during the day. Step 2. Shoulder rolls. Open the chest. How to do it. Lift your shoulders up toward your ears, then roll them backward in a circular motion 5 times. Repeat in the forward direction. Benefits: relieves tension in the shoulders and upper back, reducing pressure buildup from side sleeping or curled positions. Step 3. Seated spinal twist. Realign your spine. How to do it. Sit on the edge of your bed with feet flat on the floor. Place your right hand on your left knee and gently twist to the left. Hold for 10 to 15 seconds, then repeat on the other side. Benefits: gently decompresses the spine and improves mobility in the lower back. Step 4. Knee to chest stretch. Release the lower back. How to do it. Lie on your back. Bring one knee toward your chest, keeping the other leg extended. Hold for 15 seconds, then switch sides. Benefits: relieves tension in the lumbar spine and hips, especially helpful for back sleepers. Step 5. Ankle rolls. Support balance and circulation. How to do it. While lying or sitting, lift one foot off the ground and roll your ankle clockwise 5 times, then counterclockwise 5 times. Switch legs. Benefits: improves ankle mobility and prevents stiffness that can lead to falls during nighttime bathroom trips. Optional: deep belly breathing, 1 to 2 minutes. Lie on your back with your hands on your belly. Take a slow, deep breath in for 4 counts, hold for 2, and exhale for 6. Repeat 5-10 times. Benefits: triggers the relaxation response in the body, lowers blood pressure, and improves oxygen delivery, setting the stage for truly restorative sleep. This entire routine takes less than 10 minutes, but the payoff is massive. You'll fall asleep faster, sleep deeper, and wake up feeling more mobile and less achy. For seniors, especially those managing arthritis or chronic pain, this is one of the most underutilized tools for better health. Conclusion: sleep smart, sleep strong. By now, you've probably realized that sleep is so much more than just rest. It's a nightly opportunity to heal, restore, and protect your aging body. And the position you choose during those precious hours matters more than ever. If you're over 60, how you sleep could be silently shaping your heart health, joint mobility, circulation, spinal alignment, and even your mental clarity the next day. Sleeping on your right side or in a tight fetal position may feel comforting, but over time it can quietly strain your body. Meanwhile, back sleeping and left side sleeping, especially with smart pillow support and gentle pre-sleep stretching, can dramatically transform the way you feel in the morning. You don't need to overhaul your habits overnight. Start with one change. Try sleeping on your left side tonight. Place a pillow between your knees. Add 5 minutes of stretching before bed. These small changes can make a big difference. Less stiffness, fewer aches, and deeper, more restorative rest. If you found this video helpful, please like, share, and subscribe to Elderly and Wise. Drop a comment below and tell us, which position do you sleep in? And will you be changing it tonight? Don't forget to hit the notification bell so you never miss new videos that help you live smarter, move better, and age with strength. You deserve to wake up feeling renewed, not worn out. So tonight, don't just fall asleep. Sleep wisely.